Now, let's get to a customer conversation at Ignite. This time, we're talking to Providence and how they innovate to deliver patient-first care and enable care team effectiveness with the help of technology. With me today is BJ Moore, CIO from Providence. BJ, thank you so much for joining us.
Thank you for having me today, Allison.
All right, so tell me a little bit about Providence and your role as CIO.
Sure. So Providence is one of the largest health systems here in the United States. Our claim to fame during the pandemic is we received the first patient into our health system up in Everett. Happy to say he recovered successfully. We're headquartered here in Seattle, which really makes for a fantastic partnership with Microsoft. We really appreciate it.
Awesome. Well, you mentioned it first with the first case of COVID. Obviously, the past year and a half has forced payers, providers, patients, stakeholders all across the health ecosystem to really stress test their systems and ways of deploying healthcare. Can you tell us a little bit about what you and Providence have done to respond digitally to this pandemic?
Well, I'm a little embarrassed to say, I'm proud of our heritage, a 150-year-old company, but frankly, we didn't do hybrid work before COVID. And so when COVID hit and the lockdowns happened, we immediately had to come up with new ways to work. And so the collaboration tools like Office 365 and Teams proved to be invaluable. Teams for all of our meetings. Instead of all hands, we use Teams Live to really connect with all of our employees. We have 120,000 employees here on the West Coast, so something like that proved to be invaluable to keep that connection. In addition, for working from home, we had to deliver a lot of care from remotely. So things like telehealth, remote care delivery, where we'd actually send COVID patients home and deliver care there was critical.
Wow. I can imagine with 120,000 employees, that's a lot of Teams calls.
It is, but it's been fantastic.
Awesome. So can you tell us a key learning as CIO?
Yeah, we had this aha, when March 2020, when we were worried about our hospitals being overrun. We used to think as beds as this concrete example, right? We had a fixed number of beds in the health system. And we really came to this realization that hospital beds could be abstract. And so we used things like telehealth, remote care delivery. We implemented the Azure chatbot, which was hugely invaluable. We put that on all of our web pages. So as a patient or a potential patient, you could go on and triage your symptoms. Should I go to the primary care? Should I go to the emergency department? Should I stay home? And it really kept our hospitals from being overrun, but also gave our communities, confidence that they were healthy or what action to take. And so, those tools were invaluable to really expand the capacity of our health system.
And I seem to remember that you also had some forecasting in there to help during the pandemic as well.
Things like PPE, hospital beds, ventilators are really precious resources. So we spun up Azure environments to collect the data and build really rich forecasting models using machine learning and artificial intelligence. And we got to a point in the pandemic where in the April-May timeframe in 2 weeks, we had 85% accuracy of what the cases would be in the regions. And so that insight, being able to move resources around and those precious assets around, proved to be invaluable.
Wow. I can't imagine, you've clearly had a great effect on helping contain the effects of this pandemic. So my hat's off to you if I were wearing one, my invisible one. Before we end, let's take a quick pivot. Can you tell us a little bit about the environmental sustainability goals that Providence has?
So we've got a very aggressive goal. By 2030, our goal is to be carbon negative. And the partnership with Microsoft, again, is very pivotal in that. So we're moving out of our on-premise data centers, which frankly we don't run very efficiently, moving all of that to Azure. So as Azure gets those sustainability gains, as we get out of the data center business, it's a huge step forward in achieving that carbon negative goal by 2030.
Amazing. Best of luck to you.
Thank you.
And thank you so much for joining us today, BJ.
Thanks for having me here, Allison.
Now, if you want to learn more, check out the session, Get Long-Term Benefit from Health Data with Microsoft Cloud for Healthcare.